Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. I would like to say thank you for coming in our group presentation. It's great to see you all. First of all, my name is Yunita Andini Putri with my friends Hanin and Rafida. Okay, in this opportunity, we will discuss about cultural aspect in nursing practice in Malaysia. Let me introduce our group members. They are Hanin, Indri, Rafida, Rahma, Aisyah, Ajeng, Yunita, Melanie, Nia, Fikria, and Dian. What is the meaning of culture? Based on Cambridge Dictionary, culture is the way of life, especially the general custom and belief of a particular group of people at a particular time. The Ninja Sunshine model showed that cultural and social structure dimension include factors related to spirituality, social structure, political concern, economic, educational patterns, technology, cultural values, and ethnic history that influence cultural response of people within a cultural context. Then, do you know how about culture in Malaysia? We know that Islam is Malaysia's official religion and most Malaysians are Muslim. But Malaysians come from three major ethnic backgrounds, Malay, Chinese, and Indian. It is important to note that Malaysia is a multicultural country. The traditional Muslim greeting, salam, includes offering a handshake with your right hand while saying Assalamualaikum. Hindus say Namaste when they meet and put their hands together in front of their chest as if in prayer, while Chinese generally shake hands. In communication style, Malaysia people will be different based on their ethnicity and gender when speaking to someone. When first meeting a Malay female, don't extend your hand for handshake unless she does so first. A Chinese or Indian female normally will extend her hand for a handshake, as will Malay, Chinese, and Indian males. Now, I want to tell you about cultural aspect related with nursing practice in Malaysia. First, health service in Malaysia. In Malaysia, there have been health insurance since the 1990s. Due to the emergence of crucial issues regarding rising costs, rising taxes, efficiency, and public expectation about the higher quality of health service, Malaysia was changing its health system from a health service previously dominated by the government, currently involving the private sector. Health service in Malaysia were named the best healthcare service worldwide by the International Living Annual Global Retirement Index in 2019. Malaysia also won Medical Travel Destination of the Year 2015 in the International Medical Travel Journal.
2. Registered nurse in Malaysia. The regularity is regulated by Nurses Act in 1950 until Nurse Registration Regulation occurred in 1985. MNA or Persatuan Jururawat Malaysia is a Malaysian Registered Nurse Association. To become a registered nurse, you have to pass the Malaysian Nursing Board examination. The exam is conducted 10 times a year. There are various education pathways to become a registered nurse. Pathway 1, foundation and then degree and then registered nurse. After taking a foundation course in science, you need to pursue a bachelor's degree in nursing and pass the Malaysian Nursing Board examination before you can be qualified as a registered nurse. Pathway 2, pre-university and then degree and then registered nurse. Once you have completed a pre-university course such as STPM, A-levels, SAM, and etc., you can choose a bachelor's degree in nursing. And you also should pass the Malaysian Nursing Board examination before you can be qualified as a registered nurse. Pathway 3, Assistant Nurse Certificate, Diploma, and then Registered Nurse. You can take an Assistant Nurse Certificate and work as Assistant Nurse. After that, you can pursue a diploma degree in nursing and pass the exam so that you can be a registered nurse. Pathway 4, Diploma in Nursing, and then Registered Nurse. After you complete your study in Diploma of Nursing, you can be qualified to be a nurse. 3. Nursing specializations in Malaysia. There are over than 20 fields of nursing specializations in Malaysia. Some of the common and popular fields are children's nurse. Children's nurse will be involved in everything from nursing from a sick newborn to a sick adolescent by providing care and support needed by the patients. Children's nurses are typically employed by hospitals, nursing agencies, health centers to provide care for infants, children, and adolescents with a range of medical needs. B. Labor and delivery nurse. Labor and delivery nurse help to deliver healthy babies and get moms through the process safely. Their primary responsibilities are from monitoring babies and mothers' vital signs during labor to coaching new mothers throughout the delivery. C. Accident and emergency nurse. They treat patients in emergency situations during trauma or injury. D. Registered nurse. A registered nurse or RN is a fully qualified nurse who is licensed to practice and offer healthcare service. An RN works in a variety of healthcare settings including hospitals, outpatient facilities, and dialysis centers. And an RN with advanced education may be responsible for performing patient diagnosis and case management. E. Staff nurse. A staff nurse is a hospital nurse whose rank is slightly below that of a charge nurse. They are responsible for assessing a patient's condition and administer medication and also injections. They are basically the first person you will meet in contact when you visit a hospital or a clinic.
4. Cultural religion. First, about caring for dying patients in Malaysia. Law 20 and 15 reviews about personal experience gained as a specialist in palliative medicine based in a hospice and a university teaching hospital over 17 years. Little has been described about the cultural difference in caring for dying patients in Malaysia. The case add insight to our understanding as practitioners on how we should seek to understand and be aware of the difference between ourselves and the people we care for in order to personalize the delivery of palliative care there. One the example is a case about for the example, a Malay lady who is a Muslim in her late 40s was diagnosed with advanced breast cancer. She was married and has several young children under the age of 10. She wished to take a shower when death was imminent to ensure that she presented a clean image before the day of judgment by Allah, God, and her husband agreed to assist her. When she suspected time was short, the nurse assisted her to shower and wash her hair. Without hesitation, her husband helped to comb her hair and dress her in white garments. She expressed a calm reliance on the death and accepted that of God's will. Sayada, she said, meaning I am willing to submit myself to the God. She died on that day. For the husband of the lady in her 40s, combing his wife's hair was more than just an act of care and love. It was a preparatory ritual, a part of her religion, which was very important to her as a Muslim. On the other hand, hair combing can be easily done by the nurse who passed the patient. However, the nurse was aware of the close relationship between the patient and the husband, therefore allowing her husband to take part in the process of caring. There are some reference that we use for to make this presentation. Thank you for your attention. That's all some little information that we can share about nursing in Malaysia. So thank you very much and see you again. Bye bye.